Regular cleaning versus deep cleaning. First, let's clear up the biggest confusion. A regular dental cleaning works above the gums. It removes plaque and tartar from the visible part of your teeth and slightly below the gum line. This is perfect when gums are healthy and pocket depths are normal. A deep dental cleaning is completely different. Below the gums, where infection lives. It is recommended when bacteria have gone deeper and the gums have separated from the teeth. This procedure of deep cleaning is called scaling and root planing. Scaling removes tartar and bacteria from deep pockets. Root planing smoothens the root surface so bacteria cannot easily stick again. Now, why do you need deep cleaning without pain? How do you do it? Now, here is the part that surprises most people. Gum disease does not hurt in the early and moderate stages. No pain does not mean no problem. When gums are infected, they pull gums away from the tooth and form pockets. Inside these pockets, bacteria thrive without oxygen. These bacteria release toxins and enzymes that slowly destroy the bone. And bone loss does not hurt until it is advanced. So by the time teeth hurt or become loose, damage is already severe. That is why dentists recommend deep cleaning based on gum pocket measurements and not pain. Now, how is this deep cleaning done? Let's talk about how deep cleaning is actually performed. It is usually done in sections, often one side of the mouth at a time. Local anesthesia is given so you're comfortable. There are ultrasonic instruments that break up the hardened tartar and bacterial biofilm. Hand instruments clean the root surfaces precisely. The goal is not just cleaning. The goal is to let the gums heal and reattach. This is not surgery, there are no cuts, but it is a therapeutic procedure and not cosmetic. Now, there are different approaches and adjunct therapies. In some cases, deep cleaning alone is good enough after a normal cleaning. In other cases, dentists may use adjunctive therapy to improve results. And those adjunctive therapies are like antibacterial rinses, like chlorhexidine rinses, local antibiotic gels placed inside the gum pocket, antimicrobial chips, laser-assisted periodontal therapy. There is host modulation therapy in select cases. These help reduce bacterial load and inflammation. But here is something important. No adjunct therapy works without proper mechanical cleaning. Deep cleaning is a foundation. Everything else is supportive. Now, can deep cleaning fix bad breath and gum infection? Yes. In most cases, deep cleaning significantly improves bad breath and gum infection. Chronic bad breath often comes from sulfur-producing bacteria living deep under the gums. Mouthwash cannot reach them. Deep cleaning removes their environment. As the inflammation reduces and gums tighten, odor improves. But consistency matters. If oral hygiene is poor after the treatment, the bacteria return. Now, follow-ups and maintenance after a deep cleaning. Deep cleaning is not like a one-time magic fix. After treatment, gums need time to heal. Follow-up visits are crucial. Dentists recheck pocket depth after a few weeks to months. In many cases, pockets reduce significantly. But maintenance cleanings every 3 to 4 months are essential. This prevents reinfection. Skipping follow-ups is the biggest reason deep cleaning fails. Now, who needs deep cleaning and who does not? You do not need deep cleaning just because your gums bleed once in a while, but you may need it if the gum pockets are deeper than normal, there is bone loss on the x-rays, gums bleed easily and persistently, there is chronic bad breath, teeth feel loose or sensitive. This decision should always be based on proper diagnosis, not fear. So here is the takeaway. Regular cleaning is preventive, deep cleaning is therapeutic. You do not wait for pain to treat gum disease. You treat it before pain appears. This is how you save your teeth.